Beetroot. For years, health experts have praised it, telling you it's a miracle food for your blood pressure and heart health. They call it a superfood. But if you are over 60, there is a dangerous hidden truth you must know. The very compounds that make beetroot so powerful can quietly wreak havoc on your body in 9 surprising ways. One man, trying desperately to lower his blood sugar, found his levels actually spiked out of control after taking the wrong kind of beet. Another woman thought she was suffering from internal bleeding just because of one simple glass of juice. And the worst secret of all? If you are taking a common prescription for your thyroid, your healthy morning beet smoothie might be stopping your medicine from working entirely. We're going to walk through all 9 of these side effects one by one. I am not just going to tell you the dangers, I will show you the exact simple steps you must take to enjoy beetroot safely. Let's begin. Side effect number 9. A hidden danger for diabetics. For millions of seniors, managing blood sugar is a daily, critical challenge. You might look at beetroot, see that it's a root vegetable, and assume it's completely safe. But for those managing diabetes or prediabetes, that's where the hidden danger starts. The simple truth is that beetroot contains carbohydrates and natural sugars. The key issue lies with the glycemic index. Whole beetroot has a relatively high GI of 64, which means it can raise your sugar levels at a moderate pace if consumed in large quantities. But the real threat, the one most people miss, comes when you juice it. Imagine your beet is a sponge full of sugar, held together by fiber. When you juice that sponge, you lose most of the essential fiber. Fiber is a critical component for diabetics because it slows down the speed at which sugar enters your bloodstream, helping to keep levels stable. By removing the fiber, you create a dense, concentrated sugar drink. This concentration causes a fast, sudden spike in your blood sugar levels. A standard cup of beet juice can contain between 15 and 20 grams of sugar, a significant amount for anyone with diabetes. Think of Mabel, 72. She was trying to avoid sugary soft drinks, so she drank a large glass of beet juice every afternoon, thinking it was completely healthy. Because the fiber was gone, that juice hit her system like a strong hit of sugar, and she noticed her energy spiking, then crashing 2 hours later. Are you drinking beet juice instead of eating the whole vegetable? This is the crucial mistake. The fix: how to enjoy beets safely. Avoid the juice entirely. If you have diabetes, it is strongly advised to avoid the juice entirely. The loss of fiber makes the sugar absorption too rapid and risky. You must stick to the whole form. Eat it whole for stability. Consume the beetroot in its whole, cooked form to benefit from the fiber, which helps to slow down sugar absorption and maintain stable sugar levels. Consult your doctor. If you are taking diabetic medications, you absolutely must consult your healthcare provider before regularly adding beetroot to your diet, as it might subtly affect your medication needs. This sugar danger is manageable, but the next side effect is a much more serious risk if you already take medication. The next 30 seconds are vital. Stick around for side effect number 8, where we discuss how beetroot can act as an unprescribed second dose of your blood pressure medicine. Side effect number 8, the low blood pressure trap. If you are over 60, managing your blood pressure is likely a priority. This is where beetroot can become a silent partner or a dangerous enemy. Beetroot is famous for containing high levels of compounds called nitrates. Your body converts these nitrates into a gas called nitric oxide. Think of nitric oxide as a natural pipe opener. It acts as a vasodilator, which means it widens your blood vessels, increasing blood flow and helping to lower blood pressure. Studies even show beet juice can sometimes lower pressure as effectively as certain medications. But here is the catch, and this is where the risk lies. When you combine beetroot with your existing blood pressure medication, you are essentially driving a car with two powerful brake pedals. Your prescribed medicine is the primary brake, and the potent beetroot is a second strong brake pedal. The main danger is hypotension, or dangerously low blood pressure. The combined effect can drop your pressure too much and too suddenly. This effect is especially pronounced in seniors. Symptoms of this include dizziness, lightheadedness, weakness, a strange headache, or blurred vision. Are you monitoring your blood pressure closely after your morning beet juice? If not, you could be risking a sudden drop right now. The fix is preventing an excessive drop. Consult your doctor before daily use. If you plan to consume beet juice or powder daily, it is absolutely essential to speak with your healthcare provider first. You may need to adjust your medication or monitor your pressure continuously. Start small and test. Individuals with pre-existing low blood pressure should consume only smaller quantities of beetroot, not large glasses of juice. Monitor your pressure closely to ensure you remain within safe levels. Understand drug interactions. Be aware that the nitrates in beetroot may interact severely with certain medications, such as 5-phosphodiesterase inhibitors, which can lead to life-threatening hypotension. Never mix the two without medical supervision. This low-pressure trap can make you dizzy, but the next side effect is one that is just plain uncomfortable. Don't go anywhere, because side effect number 7 explains why your digestive system might revolt after enjoying a healthy beet salad. Side effect number 7, the uncomfortable digestive surprise. Most seniors have a more sensitive digestive system than they did in their younger days. If you have been struggling with unusual bloating, gas, or a general feeling of uncomfortable fullness after eating beetroot, there is a simple scientific reason why. Beetroot is full of certain short-chain carbohydrates that are hard for the body to digest. These are known as FODMAPs. The main troublemakers in raw beetroot are specific types called fructans and GOS, or galactose oligosaccharides. Here is the mechanism, simplified, that leads to discomfort. Poor absorption. Humans lack the necessary enzymes to fully break down these FODMAPs. Water pull. Large amounts of these undigested compounds pass into the large intestine and immediately draw water in. Bacterial feast. The undigested carbohydrates undergo rapid fermentation by the microbes in your gut. Gas production. This fermentation process generates increased intestinal gas and fluids, which severely stretches the walls of the bowels. This stretching and pressure lead directly to symptoms like bloating, gas, abdominal pain, and cramping. For seniors, especially those with conditions like irritable bowel syndrome, IBS, even a small amount of stretching can cause significant pain and major discomfort. Are you confusing this gas pain with other serious abdominal issues? It might just be the fructans causing the trouble. The fix: how to make beets easier to digest. Drastically reduce quantity. If you have digestive sensitivities or IBS, you must reduce the quantity. The amount considered low FODMAP is very small, just 2 thin slices of fresh beetroot, or about 20 grams. choose pickled or canned. Opt for pickled or canned beetroot. The processing and fermentation reduce the fructan content, making them often gentler on the digestive system. Consider the improvement. Remember the study on seniors with chronic diarrhea. They noticed massive improvement once they reduced high FODMAP foods like raw beetroot, showing that this simple change offers high value. Digestive upset is annoying, but the next issue is far more serious and can land you in the hospital. Do not move. Stay put for side effect number 6, where we expose the dark side of beetroot and the painful kidney stone connection. Side effect number 6, the kidney stone connection. You might eat beetroot every day, believing you're cleansing your body, but if you have a history of kidney issues, you are placing yourself at a very real risk for kidney stones. Beetroot is classified as a food that is relatively high in a compound called oxalate. Oxalates are strong organic acids that have the ability to bind tightly to minerals like calcium within the body. Here is how the trouble starts. Crystal formation. The vast majority, 75 to 80% of kidney stones are made of calcium oxalate. The binding. When a susceptible person consumes excessive oxalates, they rapidly bind to calcium, forming insoluble calcium oxalate salts inside the kidneys. This is how the stones form. The threat. Half a cup of raw beetroot contains approximately 76 milligrams of oxalates, which exceeds the recommended safe daily limit, 40 to 50 milligrams, for those prone to stones. Think of Bob, 68, who drank beet juice every morning to feel clean. He didn't know that the raw juice he was drinking contained an overwhelming amount of soluble oxalate, the kind that is easily absorbed and most dangerous for stone formation. Are you eating other high oxalate foods like spinach or almonds with your beets? This oxalate doubling must be avoided right now. The fix: smart preparation and pairing. Boil them to be safe. Boiling is the most effective way to reduce the oxalate content of beetroot. Because oxalates are water-soluble, boiling your beetroot and discarding the cooking water can reduce the soluble oxalate levels by up to 60 to 80%. Pair with calcium. You must eat oxalate-rich foods like beets with calcium-rich foods like yogurt or cheese. The calcium binds to the oxalate in your gut before it can be absorbed and reach your kidneys, reducing the stone risk. Managing oxalates is one thing, but that same binding power we just discussed leads us directly into side effect number 5, the risk of losing vital minerals your body needs every day. Side effect number 5, the mineral theft myth. We often think of beetroot as a nutrient powerhouse, but those same oxalates we just talked about can turn into what scientists call anti-nutrients. This is the mineral theft myth. The powerful binding action of oxalates doesn't stop at just causing kidney stones. It can actually interfere with the proper absorption of crucial minerals such as calcium and iron. The mechanism is simple and clear. Oxalates bind. Oxalates are strong organic acids that have the ability to bind to minerals. Insoluble salt formation. When you consume a high concentration of oxalates from beetroot, they bind tightly to the calcium you eat right in your digestive tract, forming insoluble salts known as calcium oxalates. Reduced availability. These resulting calcium oxalate salts are non-absorbable by the human body. As a result, The oxalates act to slow down or even block the absorption of calcium in your body. In essence, the oxalates make the calcium unavailable for your bones and other vital functions. The general rule is, the more calcium that is present as an oxalate salt, the less calcium is available for dietary absorption. Are you taking a calcium supplement at the same time as you eat your beets? This timing mistake is easy to make and wastes your money. The fix: timing and pairing for maximum absorption. Avoid supplement co-ingestion. Do not take high-dose mineral supplements, especially calcium and iron, at the same time as you consume large amounts of beetroot, as the oxalates will bind to them and render them useless. Eat them cooked. Follow the boiling method from side effect number 6. Cooking and draining the water minimizes the amount of oxalates that can interfere with mineral absorption. Protecting your mineral reserves is key to staying healthy, but the next side effect is what makes people panic. It is an issue that causes completely harmless changes that look exactly like a serious medical emergency. Stay with me for side effect number 4. Side effect number 4, the alarming color change. Have you ever eaten beetroot and then seen a startling pink or red color in the toilet the next day? If you have, you might have worried, even for a moment, that you were experiencing internal bleeding. This phenomenon is common, completely harmless, and has a specific medical name: beeturia. The cause is a powerful natural pigment in beetroot called betalain, specifically beta-cyanin. Beeturia happens because the betalain pigment is not fully broken down or metabolized or absorbed in your digestive system. The excess pigment is then simply excreted through your urine and stool. This change is not harmful at all, but it can easily cause worry because it can be mistaken for blood in the urine or dark stool. Several factors can make this more likely. Low stomach acidity. When stomach acidity is low, a common issue as we age, a large amount of the pigment may pass through to the colon. Iron deficiency. Beeturia is more common in individuals suffering from iron deficiency. Raw beets. This color change is most likely to happen after consuming raw beetroot or beet juice. Are you immediately calling your doctor because of the pink color? This simple color change is usually nothing to panic about. The fix: how to reassure yourself. Check the time. The red or pink color in your urine and stool should disappear within 48 hours of your last consumption of beetroot. If the color persists after 48 hours, or if it is accompanied by other symptoms, like burning, you must see a doctor. The definitive test. If you are still concerned, a microscopic urinalysis test will confirm it is beeturia. Beeturia will test negative for red blood cells under a microscope, even though the color is abnormal to the naked eye. Self-check. If you need to be sure, simply take a break from beets for a couple of days. If the color is gone, the mystery is solved. This pigment issue is mostly a scare, but the next side effect is real pain, often mistaken for an injury. The next minute explains how a healthy beet could trigger agonizing joint pain. Don't skip side effect 3 if you have a history of joint or foot pain. Side effect number 3, the gout flare-up connection. Gout is a painful form of arthritis that often strikes in the joint of the big toe, causing sudden, severe pain, swelling, and redness. If you have a history of gout, or even just high uric acid levels, beetroot consumption could be the hidden trigger for your next flare-up. The link is a compound in beetroot called purines. Your body naturally produces uric acid when it breaks down these purines. While beetroot is not the highest source of purines, excessive consumption can still increase your risk of a gout attack. When too much uric acid builds up in your blood, hyperuricemia, it begins to form sharp, tiny crystals which settle in your joints. The body's attempt to fight these crystals triggers a massive inflammatory response. That is the gout attack. The risk is higher for seniors because the chance of hyperuricemia naturally increases with age. Women especially see an increased risk after menopause, partly because of reduced estrogen. Think of Eleanor, whose gout was stable for years. She decided to try a trendy beet cleanse for a week. The sudden high intake of purines, combined with her age, spiked her uric acid, and she woke up one morning with excruciating pain in her foot. Are you mistaking a purine-induced flare-up for just general old-age stiffness? This simple dietary change could offer massive relief. The fix: reducing the risk of gout. Limit purine intake. If you have a history of gout, you are generally advised to limit your daily purine intake to no more than 200 milligrams from all sources. Be moderate with your beetroot. Hydrate to flush. Drinking plenty of fluids helps your kidneys filter and excrete uric acid faster, reducing the chance of crystal formation. Consider the vitamin C factor. While purines are a risk, beetroot is rich in vitamin C. Vitamin C has properties that can help the kidneys excrete uric acid faster, which is why moderation and timing is the best approach. Now, for a truly critical danger. Side effect number 2 is arguably the most important information in this entire video, as it can make one of your most common medications completely useless. Do not move. The next 60 seconds are critical for your health. Side effect number 2. The thyroid medication interference. If you are over 60, especially if you are a woman, there is a high probability you are taking a thyroid medication like levothyroxine, often called LT4. This medication needs to be absorbed perfectly by your stomach to work. Your morning, healthy beet smoothie could be canceling it out. Beetroot can interfere with your medication through 2 main pathways. A. Stopping the pill from working. Levothyroxine is easily blocked or delayed if it is taken with fiber-rich foods or supplements containing high amounts of calcium or iron. Beetroot is rich in both of these things. Fiber. Beetroot is high in dietary fiber, and fiber is known to reduce the bioavailability of levothyroxine. Minerals. Beetroot contains minerals like calcium and iron. These minerals can bind to the LT4 medication and create insoluble clumps, physically stopping the pill from being absorbed. Imagine Dr. Smith's patient Patricia. Her thyroid levels were constantly unstable and she couldn't figure out why. Dr. Smith discovered that her daily morning beet and fiber smoothie was physically preventing her body from absorbing her LT4 pill. B. Weakening the thyroid itself. Beetroot also contains compounds called goitrogens. These compounds can interfere with the thyroid gland's ability to use iodine to produce hormones. This interference happens by competing for the transport mechanism that allows iodine into the gland. While beetroot's goitrogenic effect is very weak, high consumption combined with low iodine intake can still pose a risk of developing or worsening hypothyroidism. Are you taking your LT4 with your beet smoothie right before breakfast? This simple timing mistake is making your health worse. The critical fix, the safe time interval. To ensure your levothyroxine works, you must follow this strict rule. Empty stomach first. You must take your levothyroxine pill with water on an empty stomach. The wait time. You must then wait 30 to 60 minutes after taking your pill before you consume any food or drink, including beet powder or fresh beetroot. This waiting period is non-negotiable for maximum absorption. Shield your thyroid. Ensure you are getting enough iodine from iodized salt or seafood. Sufficient iodine acts as a shield against the potential goitrogenic effects of beetroot. This is the most crucial tip, but before you go, there is one last surprising risk that you need to know about. Stick around for our final warning. Side effect number 1: allergic reactions and hives. While we have focused on the systemic and metabolic risks, the final side effect is a straightforward physical reaction that can be severe, an allergic response. Beetroot allergy is relatively rare, but when it does happen, the reactions can range from mild skin symptoms to a severe, life-threatening systemic reaction. Common signs in seniors: skin and digestive. Itching, rash or redness, hives or eczema, nausea and vomiting, abdominal pain or cramps. More dangerous signs, the warning: tightness in the throat or swelling, difficulty breathing or wheezing. In severe, rare cases, anaphylactic shock. Do you dismiss a mild rash as just dry skin? This could be your body signaling a beet sensitivity. The fix: when to seek help. Monitor your skin. Watch closely for the common symptoms like itching and hives after consumption. Seek immediate help if you experience stomach cramps accompanied by difficulty breathing or any swelling. You must seek medical attention immediately. Address other risks. Remember that even without an allergy, seniors must be cautious due to the risk of sudden low blood pressure, potassium spikes if they have advanced kidney disease, and kidney stones, especially when consuming excessive amounts. Beetroot is a powerful tool. It can lower your blood pressure and help your body, but like any powerful tool, it demands respect. It is safe in moderation, but you must be aware of the 9 risks we discussed, especially when dealing with medications, kidney stones, and blood sugar. Always talk to your doctor before adding beet juice to your daily regimen.